Hello everyone, my name is Michael Brooks. I'm the Vice Chairman of the Sullivan County Legislature, and on behalf of our Chairman, Robert Doherty, and the rest of the Sullivan County Legislature, we welcome you to another edition of our Town Hall. Today we have Joshua Potosek, our County Manager, we have Nancy McGraw, our Director of Public Health, and our guest today is Jonathan Schiller, CEO of the Catskill Regional Medical Center. We're going to start off like we always do with our latest figures, and for that I'm going to ask Nancy to give us the latest figures, confirmed cases, people currently hospitalized, people currently recovered, people who have died, and how many tested. Nancy?
Good afternoon. We are continuing to see daily increases in the number of new cases, confirmed cases. We have today 32 additional cases, totaling 845 to date of people who have tested positive for COVID-19. We have 364 of those we are actively monitoring who are not yet off of isolation or quarantine. 16 individuals hospitalized, and that's down slightly. Over 1,054 who have recovered, meaning off of isolation. Earlier when I said 364 that we're actively monitoring, those are currently people who have tested positive and are still in isolation. 22 deaths, that's not an increase over the last couple of days, fortunately. And 3,641 who have been tested throughout the county.
Okay, thank you, Nancy. Now, before we get to the rest of our questions, and by the way, thanks to everyone for submitting your questions. We have quite a few today. But I'm going to go over to Jonathan Schiller, our guest. Welcome back, Jonathan. You were well received last time, and we appreciate you being here and sharing with us what it's been like, if you will, at the CRMC through this pandemic.
Thank you very much, Vice Chairman Brooks, and Nancy as well. So the hospital is busier at times. We're busier than we'd like to be, but at the same time, we know it's an honor to be able to serve our community. The hospital did activate its surge plan in early March, and some components of that plan are still in effect. For members of the public or patients that present to the emergency department, they will notice that we are still operating what we refer to as an alternate triage area or a tent outside the hospital. And this is to help keep everybody safe so that we can do respiratory screening and COVID screening where necessary in a tent outside the building. That'll help keep everyone safe, patients and staff alike. You will also know that visitation is still restricted. I had mentioned this last time. We do allow visitation, and the state allows us to have visitation in cases of unfortunate imminent death and at the other end of life during the birth of a child for a support person. And we've had several healthy babies born in the hospital over the past 2 months, and those are the events and occasions that we like to celebrate the most. Because of that visitation limitation, we did introduce an opportunity for patients and families to connect via a virtual iPad visit, and this was made possible by a generous donation from the Allison Whitney Foundation. We're very thankful for that donation, and this has just been a real blessing for patients who otherwise are a little bit isolated and disconnected from their loved ones. On the testing front, I wanted to mention a few things about testing. We are still utilizing the Wadsworth Lab in Albany. The New York State Department of Health lab is fantastic. It is world class, and we're enjoying a good working relationship there. Those test results are reliable and accurate. We are working on an antibody testing program with the Mayo Clinic. That program will be live in a couple of weeks, and we're looking forward to being able to provide that where it's needed. And the last piece of good news on the testing front for our health system is that we now do have same-day testing available within the health system, although, as with all testing, supplies are very limited, so we're only utilizing that testing in certain cases for acutely ill patients. On the PPE and the protective equipment front, we are very fortunate to have ample PPE. We are, like other hospitals, reaching out across the globe for protective equipment for our staff to keep everybody safe, and thankful for many generous donations from members of our community and, quite frankly, other hospitals around the country who recognize the situation in New York. So many thanks to the business owners and community members who have donated what they may have had on hand to help keep our staff safe. On the ventilator front, our capacity of ventilators is over 20, and thankfully, we've been very fortunate that through excellent care and early diagnosis, we're right now only have 3 patients on the ventilator. And this truly is a credit to everyone in the community washing their hands, covering their faces, and staying healthy. The community support has been excellent. We're so fortunate to have, I couldn't even name them all of the restaurants and businesses that are supporting the hospital. For some of our staff members who may spend hours and hours in garbed up in PPE all day, this may be the bright spot in their day, coming out and knowing that they're not alone and that someone in the community is thinking about them. And just one closing comment. If at all we're successful in this, it's because of that community support, and it's because of the staff that we have at our hospital. Our staff are working very hard every day, and they're doing an outstanding job. Please know that you are in good hands in our community.
Thank you, John. On to our second question. This is for Nancy. Why do you think we've seen a bigger increase in cases of late? And what do you think are the reasons for the larger amount of cases in Monticello and Liberty?
So there's been a greater number of tests being done. As you can see from the increasing numbers of tests from last week, we're up to over, what did I say, 3,000 and some odd tests. So the bigger increase is partly a function of the more people who are getting tested and testing positive. The other issue is wherever you have a higher density of population in any county, you're going to see more cases because there's more people and there's more opportunity for spread. So, you know, Monticello, Liberty, and other parts of the county are obviously more people live there. Now, that doesn't mean that those areas of the county are more risky, as we explained when we released the map, because you can travel somewhere else outside the county and be exposed. So people can get it anywhere. It's not a function of where they live. So this is why it's really important to underscore, and we can't repeat it enough, the importance of following the executive order to wear masks, whether you are out and about getting groceries or you are an essential worker, you're in an office setting. It's really important, especially if you're within 6 feet of a person. Don't assume that because a person looks healthy or, you know, is not coughing or doesn't have a fever, that they can't be a carrier. We're finding that people can be asymptomatic and still transmit the virus. This is why it's so important, as sort of cumbersome and annoying as it can be to wear a mask, because it's a change in behavior for everybody. It's uncomfortable. It's not what we're used to doing, but it's really important. The mask in a normal office setting or a workplace or in the public is not to protect you, it's to protect other people in the event that you are, you know, you cough, you sneeze, you breathe, you're too close to somebody. And I can't underscore the importance of washing your hands, because you can touch a surface that may have virus on it, that maybe wasn't cleaned recently, as much as we reinforce disinfecting commonly touched surfaces, you know, door handles, handrails, desks, gas pumps, handles, all kinds of things, even money, you know. So hand washing is really important, and then staying home as much as possible unless you have to go out. We're seeing more cases because, as I said, testing is starting to pick up and increase, and the majority of the increases in the number of tests have been done within the last week or so.
Thank you, Nancy. And the next question will also be for you. As a small business owner, if and when we open back up, and I come into contact with someone on the job who has tested positive with COVID-19, does that mean I have to close back down and quarantine for 14 days? Does that also apply to cafes and small restaurants, retail, etc., who have more than 5 employees?
So there's no easy answer for this question. There's a lot of different scenarios and circumstances where guidelines may, all the guidelines currently follow New York State and CDC guidelines for isolation and quarantine if somebody has either tested positive or come into close contact with someone who has tested positive and needs to go on quarantine. So for essential businesses, the guidelines for the 14-day quarantine do not normally apply. They apply to essential businesses for 7 days as long as the person is asymptomatic and has no fever for 3 of those days after onset of symptoms. So this can get pretty complicated, and that is why it's so important to consult with your local health department, with public health. In certain circumstances, after we consult with a state health department, if we need to, and someone remains asymptomatic, they may be allowed to work with a mask and certain other protections in place and daily monitoring if it would be an extreme hardship or impact on the essential business operations or on the community, such as food service workers or healthcare workers. It's really important to consult with us and don't make those decisions on your own or just from what you think is the okay thing to do. The county EOC and Incident Command Team has put together a recovery working group that's actively working on assembling training and guidance to share with local businesses so that they're prepared to reopen safely and as soon as the opportunity permits. And that is going to be rolled out very soon, and that will also be consistent with the governor's guidance and directives in the executive order in terms of the approach that each county and each region is given based on their current circumstances, number of cases, and whatnot.
Okay, Nancy, next one is for you as well. Has the Sullivan County Department of Health been cleared, authorized, instructed, or mandated by any state level authority to issue permits allowing the summer camps in Sullivan County to open?
So I want to be clear that Sullivan County Public Health Services does not issue permits for summer camps. We are a partial services health department based on our population size, and the district office in Monticello, which is an arm and part of the New York State Department of Health, is the one who issues camp permits. So with that said, we work very closely with the district office when it comes to the risk of communicable disease and any outbreaks. We're receiving some very different signals from the state with regard to summer camps, and we have to be honest and open about that. On the one hand, preparations to open camps are allowed to move forward for this Empire State Development, and it's a necessary step. You have to plan in the event that everything looks great at the end of June, and all of a sudden you don't want to start doing your planning at that time. You want to do it ahead of time. That doesn't mean that the green light has been given on opening camps. It's a necessary step if there's going to be any possibility of camps opening and operating safely this summer. We need to remember that for many families who send children to camps in Sullivan County, this is how they're able to work in the summer when schools are not normally open, by sending their children to camp. As long as we can do it safely, and that is the most important word, safely, there's an economic benefit to having the kids in Sullivan County, both to us and to the places where the kids come from. The other signal is from the New York State Department of Health. Under the current New York Pause executive order, There's no way for a camp to operate right now. It requires mass gatherings of people, congregate meals, and violations of social distancing guidelines. That's where we are currently. Conditions might change significantly for the better by the end of June, and the CDC and Department of Health are looking to provide guidance to camp operators so that they can open this summer in a safe way that keeps kids, counselors, and local residents safe. I'll end it there by saying there are many different types of camps, and they don't all fall under the same regulatory rules. So we need to be careful when we're talking about summer camps, what types of camps, because in Sullivan County there are 3 or 4 different types of camps, and they're not all regulated in the same way. So I think maybe at a future town hall we can address some of those questions about the differences between camps and who oversees them.
Thank you, Nancy. Our next question, I'm going to ask Josh to answer first, and then I'm going to ask Jonathan if he could add some additional comments. The question reads, why are towns allowing the camps to open when Governor Cuomo has stated that any opening should be coordinated so as not to have people flood an area with unnecessary activity and contact? We have one hospital. What is the county plan to avoid our system being overwhelmed? Joshua?
Good afternoon. So I think Nancy did an excellent job of kind of explaining where we are with camps, and there's quite a few questions throughout this session on camps and bungalow colonies. So as she stated, Empire State Development has deemed the opening or the preparation of opening of camps as an essential service. So we are taking the position, working with towns, local governments, and then the EOC to plan for them opening. Obviously, we're at the last day of April today. The camps normally open near the end of June, so 2 months away is a long time to know exactly what's going to be happening on the ground. We all hope that the economy is back open as much as possible by then, including camps. So we're taking that position in planning. Obviously, if this situation isn't at that point, we will take a different stance and look at different restrictions on opening of various businesses and camps in conjunction with DOH, state, EDC. And I asked Jonathan to kind of comment on the plan for our summer normal swell in population at our hospital.
Thank you, Josh. So as we do every year, we are preparing for our summer volume increases that we see across the community, and when appropriate, we do welcome those summer visitors with all the caveats that have just been mentioned by Nancy and Josh. With regard to the hospital's capacity itself, the emergency department capacity is tremendous, and you've seen that through the surge that we've had. We're probably operating at about 15 to 20% of our actual capacity in the emergency department. So we have tremendous flexibility there. With regard to the overall hospital surge plan, we did prepare 6 units to open extra as part of surge, and we only opened 2 of those units. So there definitely is excess capacity existing within the surge plan should we see something unusual occur over the summer with regard to patient volumes.
Thank you, Jonathan. Next question is for Josh. I run a residential summer camp in Sullivan County. What do you believe the timeline will be when it comes to guidelines surrounding opening up day camps as well as residential camps?
Another good question about camps. Obviously, residential camp owners are in a tough spot, like a lot of other businesses, about when they'll be able to open safely. I know this is the time that they're starting to spend money on maintenance and hiring of staff and getting ready to open. I wouldn't say there's really a time frame per se. Obviously, New York State has kind of given an outline on how they're going to plan on reopen regionally, starting with manufacturing and construction, seeing how that operates for a 2-week period, and then looking at phase 2 where they'd open up other businesses at that point. So I think we're in this phased approach, and have to take a look after May 14th in 2-week increments on if lifting the pause is successful. Hopefully, everyone hopes it to be wildly successful, but we're going to have to take that wait and see approach. We're working weekly with camp owners, both secular and non-secular, on how they would open safely in the event that the state has allowed that. So we're in the planning phase, hoping we are able to open, but obviously the conditions in our community are going to dictate what types of businesses, camps included, are able to open at that time.
Okay, thanks. Thank you, Josh. Next one is for Josh as well. Will there be travel restrictions surrounding campers and staff? For instance, my camp works on a national level with younger feeder camps. Once the campers have hit high school age, they join us on our site. Will there be restrictions for people coming from around the country, or even for people who are in the Northeast U.S.?
Another good question. Obviously, if you've paid attention to what Governor Cuomo is trying to coordinate in the Northeast regionally with some of our neighboring states on opening up economies regionally, not even just looking at counties, but looking at regions of the state, but also coordinating with Connecticut, Pennsylvania, New Jersey, Massachusetts, depending on what region you're in, to try to coordinate movement within those bigger geographic regions. Obviously, we can't restrict movement into or out of our county at this point, but we are working again with camp operators on how safely we can have both campers and staff be healthy and operate a camp this summer. And we're also looking at issues surrounding would it make sense for large groups of campers to enter into various parts of our county to try to, in regards to social distancing and such. So those are some of the kind of conversations that we're having locally about movement of campers in and around the county, but I think we're going to have to take our cue from New York State on this regional attraction and movement of campers and staff from the state level.
Thanks, Josh. Next question is for Nancy. Do you see antibody testing as a prerequisite for campers and staff to be able to join us this summer?
So I want to be really clear, this is not going to be a local decision. We will follow, as we currently are, New York State Department of Health, Centers for Disease Control guidance, and the executive guidance from the governor's office. I know that nobody wants camps to open if they're not safe for children and for everyone. We do have concerns, public health concerns about the quality control of antibody testing. I know more and more antibody testing is becoming available, and people think that that's the magic answer to showing immunity or, but we don't really know what antibody tests are really telling us, since we don't know currently if people can be reinfected or be contagious after interacting or being exposed to the virus for a second or third time. Testing positive, showing antibodies does not necessarily show immunity or protection. So whether or not it's going to be required is really not a question we can really answer right now. The research needs to catch up. It needs to be standardized across the board. There's a lot of antibody test kits out there that are showing high rates of false negatives and higher rates of false positives, sometimes 30 to 50%. That is a real problem. And until it's standardized and FDA approved and we get more guidance, I don't think that we're going to see any recommendations making that a requirement, because it's not really telling us that much right now. We have to wait for the science to get caught up.
Thank you, Nancy. And next question is for you as well, dealing with camps again. If sleepaway camps are open, how will they practice social distancing when the campers and staff eat together in dining halls and sleep in dormitory-like conditions?
I'm going to use the measles outbreak last summer as an example of how to answer this question as we currently know, because there's a lot we don't know. However, we know that when children's camps are getting ready to open and preparing and providing education. They're preparing their camps and they're training and educating staff and whatnot. They have to go through an inspection process with the district office, New York State Department of Health, before they're allowed to open. And I see the same thing happening here in terms of showing that they have a plan when they apply for their permit for addressing any potential communicable disease. And I know that the State Health Department has been working on guidance for summer camps for a while with COVID-19 in mind. So with with the measles outbreak last summer, I think some of the summer camps really did a good job of identifying areas where they could quickly isolate anybody who was sick or exposed, and quickly get them out of the camp and get them either home or to healthcare facility. So I think there will be some similar measures and planning taking place. However, this virus is much more contagious, and I think that there's a lot of unknowns in terms of how it affects children. We haven't seen a lot of illnesses in children, but remember, we have a lot of staff and older folks who volunteer in summer camps who may be more vulnerable. So there's a lot of unknowns, but I do know that the social distancing will definitely be part of the required plan. Just like businesses and just like the rest of us, camps are going to have to plan to operate very differently than they have in the past. And I think the guidance will address some of those issues.
Okay, next question is for Josh. What will be done to protect residents from summer camps, bungalow colonies, and other areas where social distancing cannot be enforced?
Again, we're meeting weekly with both secular and non-secular camp owners in the county to come up with these very plans on protecting not just the campers, but their employees and the general public at large. Obviously, social distancing, as Nancy had just mentioned, can be accomplished pretty much virtually anywhere with responsible people that are educated about what the requirements are. When we've educated people that have failed to meet the social distancing, we've got great success and cooperation once they become aware of the concerns and issues. So as a resident or a visitor here, if you do see people violating social distancing, please contact state police, local PDs, sheriff department, or use the State Pause Enforcement Task Force hotline. That has been a good tool that we can get some of these issues addressed. And like I said, I thank both visitors and residents alike that have been approached with some of these issues, that have cooperated and complied with the executive orders.
Okay, next question is for Jonathan. What is the percentage of positive cases you are expecting when the population increases by 70,000 or more, as it does each summer? Can we handle that?
Thank you. So the percentage of positive cases would get back to the number of patients that we actually test. If we were to go through testing anyone who presents, whether they're asymptomatic or symptomatic or have been exposed or haven't, the actual percentage of positives that would come back is very low, versus if we were to be testing those who are at high risk because of exposure or perhaps have symptoms themselves. The good news for us is that, as I had mentioned earlier, regardless of what the actual percentage is, we believe that the number will be well within our capacity to handle. When we exercised our surge plan with our existing county population, as I had mentioned, we only had to activate 2 out of our 6 surge units. So we do know that as we see an influx of increase in people in the community, we still will have capacity to handle whatever may come our way.
Okay, next question is also for Jonathan. What is the capacity of CRMC, and at what percentage is it full at this moment?
So this is a numbers question, and that happens to be one of my talents. So as far as Catskill Regional Medical Center goes, in terms of the actual number of beds that we have operating, it's 130, and we're under 50 patients right now at this time. So there's certainly we're not full, although we did certainly see a peak when we surged earlier. We're not full, and we do have plenty of capacity at this point now.
Okay, next question also goes to Jonathan. With Governor Cuomo's announcement that elective surgery can resume in Sullivan County, is Catskill Regional Medical Center in a position today for that with its current coronavirus bed population? If not, what kind of timeline are you looking at for elective surgery? And what would need to happen at the hospital to resume those surgeries?
So we think the governor made the right decision by allowing hospitals to begin performing elective procedures. There are some hospitals, especially those further upstate, who have no patients whatsoever. And for them and their communities, it's important that they get back to providing elective surgeries as soon as they can. For us, the governor's office did have his announcement yesterday, and the New York State Department of Health released the regulatory guidelines that hospitals must follow in order to restart running an elective surgery program. So we're evaluating all the elements of the regulatory framework, and I'll list them out just so that everybody knows. One of the first requirements is that there be adequate PPE, including monitoring our utilization patterns and inventory levels. That we have the ability to perform preoperative COVID-19 testing, which I had mentioned earlier. That we have adequate staffing levels, because it's possible, just like any other member of the public, that a hospital member can become ill with the virus and have to go through the isolation and quarantine process. In addition, the Department of Health requires that the hospital have a minimum capacity of at least 30% of both medical, surgical, and ICU capacity available at any given time for a surge. So we anticipate that we'll meet all of these requirements and that we will soon be able to resume performing elective surgical procedures. Planning on having surgery before the COVID epidemic, we ask that you stay in touch with your doctors and your surgeon's office about scheduling purposes. Please do not call the hospital directly to schedule a surgery. That is done through the physician's office. In addition, please know that we are able to perform urgent and emergent surgeries at any time, and encourage patients with emergent conditions not to sit home waiting, but please reach out to your doctor and get the medical attention that you need.
Okay, and our next question is also for Jonathan. Do the CDC's guidelines of 2 weeks of decreased hospitalizations before reopening the region back up apply to Sullivan County? Many residents seek treatment at other area hospitals besides CRMC. So I'm concerned that using just CRMC numbers won't paint an accurate picture.
Thank you. That's a good question. To the best of my knowledge, the CDC guidelines, I think they're excellent, and they do apply to Sullivan County. Not everyone may be aware that every hospital in New York State reports its census daily to the New York State Department of Health, and that the state has the ability to look at utilization and capacity at the hospital, county, region, and state level. The surveillance systems that have been developed at the county public health level, as well as at the State Department of Health level, have increased in both the capacity and complexity of analytics. We have the ability to identify spikes and hotspots, likely transmission corridors in near real time. And these systems are getting better every day. I do think that this level of detailed information will help our public health officials and hospital operators ensure that we're informing our public and regulatory bodies in near real time if we do see a cause for concern. Regardless of what is opened economically, I feel a duty to remind everyone that the foundation of any success we've had so far, in addition to what I have mentioned before, is that we don't forget the basics that got us here of hand washing, face covering, and social distancing. Thank you.
Thank you, Jonathan. Before we get to our last question, which will be for Nancy, I just want to express our gratitude to Jonathan and all the people at Catskill Regional. You are a tremendous, valuable asset to the county, and we're proud to have you and all the folks at CRMC. Truly mean that. Our last question is for Nancy. And it's a long one. From what I am reading, nothing we have at the moment will stop COVID-19. Our effects to flatten the curve only help in trying to keep our heads above the water, but it doesn't mean it doesn't mean the virus, has moved on. It's reading word for word. Until we reach herd immunity, meaning virtually everyone must be exposed to it. And many of us older autoimmune comprised people will die. Or we develop a vaccine and thus makes ourselves immune to the virus. It is still here. Social distancing, masks, and closing non-essential businesses is just a way of lowering the curve and possibly buying more time until a vaccine comes out. Do I understand the situation correctly?
So I really appreciate the question, and it's complicated, but I think that the individual who sent the question did a really good job of sort of outlining what many people's concerns are about what's being discussed at the state and national level about immunity, about a vaccine, about flattening the curve, social distancing, and all of these public health measures to try to keep everybody safe. Obviously a vaccine is our best chance for prevention, but that's going to take a while, longer than we like, and especially, longer than we probably can economically. So until that happens, and they are currently fast and furious on a vaccine as well as other treatments, we have other public health measures to sort of gauge and measure safety or lack of safety. What is safe, what is not, what can we do without risking more people from becoming infected and sick. So flattening the curve is one of those sort of words that we're all familiar with now. And yes, it was learned very quickly by a lot of people in terms of what that means, and it's because we don't want to overwhelm our healthcare system, especially in the more rural counties that are upstate, that are smaller and cannot expand very quickly or exceed a certain capacity if large numbers of people come or need beds. So herd immunity for any disease, communicable disease, such as, we'll take measles as an example, one we're familiar with in this county from last year's experience. Anywhere from, depending on the disease, you develop herd immunity normally when anywhere from 70 to 90% of a population has been exposed and becomes immune. The challenge with COVID-19 is that we don't yet have enough information to determine whether there will be herd immunity, how many times someone needs to be exposed in order to develop immunity. We're certainly finding that people can be reinfected more than once. Some people test positive and are asymptomatic. It doesn't seem to really impact them as much as others. That's why we talk about protecting our vulnerable populations, anybody with underlying health conditions, and individuals over 60 are at higher risk. So it's a loaded question, and we need to give science time to catch up with the concepts, and we're learning more and more about the novel coronavirus, and the scientists need to really guide us, and we need to make public health decisions based on the best available science. Contact tracing goes way back to the 17 and 1800s as a public health measure to quickly identify and isolate individuals who have a specific disease or illness, and have them isolate from others. And that's why it works, because if you keep someone during the contagious period, and here we're talking generally from what we understand now, 2 to 14 days is the infectious period where somebody can be exposed and then develop symptoms. Isolate an individual for 2 to 14 days, and hand washing and wearing masks and not going out into public. That 2-week period will help reduce the number of people in a population that are exposed and become sick. So those are really important preventive measures. Contact tracing gives us better numbers in terms of how many people have been exposed, how many people are testing positive, both in terms of those who are asymptomatic and those who are symptomatic. And then again, we need to remember, and I think we forget this sometimes, to remind ourselves that there's a lot of people who are recovering who have developed illness from being positive, and they have not had to go to the hospital or be hospitalized. They've been able to recover at home. And that's why it's so important that we take those preventive measures, the hand washing, the wearing of the masks, the cleaning and disinfecting, and staying away from other people. So public health sometimes doesn't get the attention or funding that it needs until there's a huge outbreak. And then we're like, oh, you know, prevention works. So we're all in this together. We have a wonderful team, a lot of leaders throughout the county, and everybody is pulling together, including the business community and everyone. So we'll get through this. And again, I just want to thank everybody, and especially Mike and Josh and Jonathan for joining us today, and the legislature. So thank you.
Okay, thank you, Nancy. Once again, I want to thank everyone for sending in their questions. It's only a success to get the information out if you participate. Our thanks go to Josh for joining us, for Nancy for joining us, and for our guest Jonathan Schiller for coming back. And before I close, I just want to ask once again about, if you have not already, please fill out your census. Our numbers are lagging. It's so important, so please, if you haven't done it yet, please fill out the census. And I want to close today. As often happens, I get inspired by my daughter. And being home, a teenage daughter, doing her schoolwork, just talking about political science, global studies, history, and talking about different types of government. And she probably doesn't even know that she inspired me to get thinking about the events of the past few weeks. And I just wanted to share some things with everyone because I think it's so very important. And every father out there that has a daughter, especially a teenage daughter, probably can appreciate the amount of times that you have inspired when your daughters don't even realize that they did indeed inspire you. So with that being said, we the people of the United States, in order to form a more perfect union, so starts the preamble of the United States Constitution. We the people of the United States, in order to form a more perfect union. Not a perfect union, but a more perfect union. We are all imperfect people living in an imperfect world. Our founding fathers knew that perfection is not something that we the people could ascend to on our own. But they provided a framework into which we as Americans could live and aspire to reach that end. Keeping that larger perspective in mind, all of us to one degree or another are going through a very difficult and stressful time. There are a lot of unknowns for us to assess, and that among other things makes us anxious about tomorrow and beyond. We all have opinions and thoughts about it. There is not a textbook that we can read that explains every step that we need to take in order to get past the challenges we have been facing. What we do have is our own life experiences, our own good judgment, and our own common sense to help guide us. We as a legislative body try our best in utilizing those basic attributes to help guide us as a county to a better tomorrow. Often decisions are not easy. There are differences, that is healthy, and consensus moves us forward. Yes, there is a degree of uncertainty now that is different than we have experienced in the past. But there are a couple of things I can guarantee. As being representative of the people we serve, the Sullivan County legislators are not perfect. But I can also guarantee that all of your legislators care deeply about Sullivan County and its people, and have immense appreciation for the dedication of the EOC, our healthcare workers, police, EMTs, and firemen. All of you have risen to the occasion, and we applaud you for doing so. And with that being said, everyone be well, and bye for now.